Hello, everyone. Welcome. We're going to just give another minute as all the participants are streaming into the room, and then we will begin the webinar. Thank you all for being here with us today. So, hello, everyone. I hope you're all having a great day. Thank you for joining us for this webinar with some amazing speakers. So this is our web conference series launched in partnership with Access Employment. We're thrilled to have everyone here today, our speakers and our audience as well. So it's great that you were able to make time. So welcome to the industry-specific web conference for internationally educated nursing and medical professionals. Please note that this is going to be recorded and posted on our website for those of you who cannot stay for the entire session or would like to rewatch it or share it with your community. My name is Ramya Ramanathan. I'm the editor of Canadian Immigrant, and I'm joined by my colleague Laura Jackman, who is behind the scenes and is going to be taking your Q&As. So she's going to be making sure that this is an interactive discussion. During this web conference, we have speakers from across the nursing and medical field to help you on your journey to a career in the nursing or medical field. Before we start our session, with our first speakers, we have a short video to share from one of our sponsors, Western Union, who supports Canadian Immigrant and allows us to run these webinars free for newcomers across the country. So my colleague Laura will share the video. Thank you, Laura, and thanks to Western Union. Now let's get started with our first speaker from Access Employment. We're thrilled to have Cameron Moser here with us today. He will be speaking about uh, career pathways and if you have questions for him, feel free to put it in the Q&A box or use the chat feature on the webinar. I'm sure you can find them. So Cameron, the floor is yours. Please go ahead.
Thank you so much. So everybody, it's a pleasure to be with you today, and to share some space with you. I'm going to go ahead and share my screen. We're going to spend a little bit of time talking about career pathways that you might want to engage in Canada while you're pursuing licensure in your field of study or because you've chosen not to pursue licensure. So I will go ahead and share a screen here. All right. Are you seeing my screen there, everybody?
Something is starting. Yes, we're good.
Beautiful.
Cameron.
Beautiful. Okay. So just a little note, I'm here from Access Employment. I'm the Senior Director of Services and Program Development at Access, where I'm responsible for our pre-arrival programming, which supports individuals who have been approved for permanent residency, but who haven't landed in Canada yet, as well as our programming for internationally educated health professionals, where we primarily support internationally trained physicians, pharmacists, and dentists in securing non-licensed employment while they pursue licensure or because they've chosen not to. Access Employment, if you're not familiar with us, are a leading employment services organization that delivers services across Canada. Every year, we work with about 56,000 job seekers, about 4,200 plus employers. And we've been doing that for a long time. And that's really helped us to maintain our focus on just employment. It's the only thing that we do. Our Healthcare Connections program is the primary mechanism that we use to support internationally trained healthcare professionals. And in that, we're working with funding from Immigration, Refugee, Citizenship Canada, from the province of Ontario. We work in close partnership with the Canadian Pharmacists Association, as well as Team Primary Care, which is a consortium of medical schools, medical training providers, and regulatory bodies for the medical profession. And our goal here is really to keep people on track, keep them putting their skills to use as fully as possible in Canada. We do that. I want to, before we dive into some of those pathways, I want to talk about how we do that, because there's a wide range of programs and supports available to internationally trained physicians in Canada. Some of them are things that really can lead to a lot of support, and others are geared towards sometimes moving people into positions that they may not be that interested in. So it's really important for us as an organization to make sure that if we work with someone, we're meeting them where they're at. So if you're interested in pursuing a career in medical administration or clinical research, we want to start with that lens, right? Not trying to identify something for you and push you into that, but meeting you where you're at and being respectful of the really difficult transition that you make post-immigration, right? It's very it can be quite difficult for physicians, nurses, pharmacists, dentists to deal with the inability to practice within their field after immigration. And we want to be very respectful of that. We're here to help people get employment success, but not just any kind of employment success. We don't support moving people into roles that don't use their skills and experience. We don't support moving people into roles that can't help them support themselves and their family. We're looking at getting people the best possible employment that they can. And to do that, we have to use a lot of different approaches. And we have to work with our clients holistically, really looking at the broad range of employment supports, social capital development supports, networking supports, psychosocial supports that you need to be successful in your career transition after immigrating. Largely that takes part of an integrated service delivery plan where we pull all of these elements together within 6 weeks of dedicated training that include job search, support preparation, employment counseling, networking, and job referrals. That 6 weeks of really intensive training is one part of what we do, but we know that that's not nearly enough. We would never just think that this 6 weeks of intensive training is enough to support someone in such a complex career transition. So we work closely with all the participants in our programs for 1 year after they've graduated to make sure that we're providing them all of the employment, job retention, and job promotion supports that they need to be successful. And especially in our Healthcare Connections program, we have long-term relationship with clients who are doing very well in the health sector and actually are a prime driver of our success because they come back to us once they're in management positions to hire the clients that are taking part in our services. And it produces results. You know, right now we have an 88% employment rate in our Healthcare Connections program. We've served almost, this number 455 is a little off as of earlier this week. Right now that number is right around 500 individuals. When I say 88% employment rate, that's just people who moved into the field. In all of our Healthcare Connections cohorts, we'll have 5 to 6% of people who decide that they're just going to focus on licensure full time. So when we look at our overall success rate, it's usually around that 95% of people who are meeting their goals. Wanted to give you a great example of Benish here. Benish is an internationally trained health professional who had a great deal of experience in public health. We supported her in getting an awesome job at Sinai Health, which is a large hospital here in the Greater Toronto area. She started off as a project coordinator and then was quickly promoted into a project manager position, where she's been instrumental in launching a wide range of community health initiatives that help underrepresented communities have their voices heard in Canada's health systems. And she's also come back, and I'll highlight this a little bit more later, come back to us to build on that partnership and help more internationally trained health professionals get into high quality employment at her place of work. Now, when we're working with individuals and when we are talking with someone who may be in your situation, who's an internationally trained physician who just landed in Canada, we know that there's a lot of challenges that you face. Um, One of those primary challenges, and we have to be very upfront and honest about it, are psychosocial barriers to career change, right? Particularly within the medical profession, as a helping profession, physicians are used to telling other people how to get help and advising other people on the help that can support them, but aren't always geared towards getting that help for themselves. We know that our clients are facing, status anxiety, identity loss related to their inability to practice, and a wide range of other psychosocial barriers that we take very seriously. And we integrate elements into our program that help them explore those and overcome those barriers so that they can achieve career success. Many of our clients also have undeveloped job-seeking behaviors. So after pursuing their training as a physician or a pharmacist or a dentist, they don't often apply for jobs in the same way that people in the rest of the world apply for jobs. So the idea of going out there, having crafted resumes, marketing yourself to employers, is a very different thing once you move out of a licensed area into a non-licensed area. And we provide a lot of supports for that. And the third part of that puzzle is really employer assumptions. Because a lot of employers, without support from an agency such as ourselves or a care center, who's going to be speaking after me, they will think, well, does this person's a doctor or this person's a nurse? Do they really want this job? Are they going to stay here? Is it something they're actually interested in? So we do a lot of work with the employers that we work alongside to make sure that they're not making incorrect assumptions about clients' abilities to take part in non-licensed work and their willingness to do so. So in the work that we do when we're working with healthcare professionals, and something that needs to be on your mind, whether you've just landed in Canada or you're preparing to land in Canada, is if I'm not going to be able to practice in my licensed profession right away, what am I going to do? How am I going to stay connected to the health sector? And how can I put my skills to use as fully as possible? We help support clients in that journey by looking at different job families within the health sector, by drawing upon your skills and your experience to identify what kind of jobs you might be at an advantage for, what kind of jobs you might be interested in, and also then tying that into labor market information that looks at whether or not those kind of jobs are available where you're looking to secure work. So we work and help clients explore careers in medical administration, and clinical research, social services, especially for pharmacists and dentists. We look at non-clinical roles within the pharmacy side and within the dentistry side. There's a wide range of those. And I want to, that process of exploring all of these areas is really involved and really personalized. It takes a lot of work with our employment consultants to narrow down what it is that you're interested in and what it is that you'd be good at, and really importantly, be happy doing, because we all have to live our lives. I'm going to take one of these career pathways, because we're all here for just a limited amount of time today, and delve a little more deeply into it, and really look at clinical research. So imagine you had come in, you're receiving services, you've gone through some career pathing activities, and you've said to yourself, clinical research looks like one area where I feel I could contribute in Canada after immigrating. It's a pretty popular non-licensed career option. Many of the internationally educated healthcare professionals we're working with have some experience in conducting research. So we partner with research organizations, we partner with trainers in clinical research, and we use a capstone approach so that program participants can learn about the real work processes in clinical trials, discuss practical scenarios, receive one-on-one coaching. But most importantly, that's not, an academic training component that's purely academic. And the whole time that we're doing that, We're connecting the skills that you're developing in clinical research into how you would apply to an interview for clinical research positions. So very, very critical that we're not delivering training in isolation, but really we're delivering training and immediately connecting it into that labor market need that you have to connect with employers and secure employment. Earlier, I talked about Mount Sinai, and we work closely with an innovation lab at Mount Sinai, the Health Commons Solutions Lab. And I wanted to give you an example of that. They do a lot of community-based research projects where they're looking at either clinical trials within communities or how to activate community resources. And we worked very closely with them, collaborating, focusing on the needs of that sector and engaging them as an industry partner to create employment opportunities for 4 of our recent participants. So Dami and Abdul Rashid, and Ibadun and Anita, and Shrutian. And those positions really opened up enormous doors for them within the health sector, where they were able to take part in very targeted research opportunities that took advantage of their previous skills and experience, gain highly, highly valuable connections within the health sector, and then turn that into continuing and ongoing career success. So that engagement with industry coupled with the training leads to real results and leads to people making meaningful changes in their careers. On top of that, we have had clients really all across the clinical research spectrum, get really high quality jobs at a variety of hospitals, clinical research facilities, universities, training institutions, et cetera, where they can put their skills as a health professional to use while they're pursuing licensure. Now, if you are not yet in Canada, right? If you are preparing to immigrate or you've already been approved to immigrate, this slide's for you because I want you to really be thinking very consciously about what it is that you're doing. We surveyed our alumni last year, our IEHP alumni, and the results of that survey were really troubling to me. You see some of those results here. Almost 70% of the participants that we surveyed reported that they didn't explore licensure pathways outside of Ontario, right? These were for clients who landed in Ontario, all of these survey participants. And there's a lot of places that you could settle in Canada and a lot of different pathways to practice in places that are available outside of Ontario. 75% of them thought that they were likely to achieve licensure in Ontario within 2 years. The rate of licensure for physicians is much, 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 much lower than that. Almost 2/3 of them spent 10 hours or less exploring non-licensed employment before they came to Canada. So these kind of results can lead to some real difficulties once you've landed, right? If you are still exploring immigrating, or if you're in the process of you've been approved for immigrating but haven't landed yet, highly encourage you to be spending more time thinking about what your employment journey is going to look like. If you're a nurse, you've got a great partner here in Care Center for Nurses who can offer you those supports pre-arrival. But really exploring much more deeply what it means to integrate into the health system after you immigrate. It's a complex and difficult journey. Now, as we look at kind of after you've landed, continuing to grow, I just wanted to end up the little bit of time that I have today with some ideas that I thought could be helpful to you, right? As health professionals, you've done an enormous amount of study and work to get into the positions that you're in. And it's difficult then to have to go through another whole other licensure process after landing. There's some things we work with on our clients and talk about with our clients that help them in exploring what that transition looks like and developing the kind of mindset that they need to succeed in that process post-immigration. The first kind of thing we talked about in the slide before is really getting data and evidence to be prepared, right? Really knowing what it is that you're looking at. And then we talk about things that we can inculcate in ourselves, right? Ways that we can contribute to our own ways of viewing the world and thinking that in the long term can contribute to our success and happiness. One of those, we work really closely with clients on adopting a growth mindset, on looking at possibilities, recognizing barriers, but always approaching things with a problem-solving framework where we're looking to develop and grow in all the situations that we're in. The situations surrounding licensure, particularly for physicians in Canada, are very complex. And there's a lot of things that you can't influence in that. You know, you can influence maybe landing in one province or another province where there's more or less opportunity. But there's some processes which are just there, and they're slowly changing over time. And when we work with clients who have a mindset of, you know, simply pointing out the problem and saying, well, if this problem weren't there, I would be licensed right now. That is true. It's 100% true, but it's not helping that person in that situation in their life with their family to move forward in the ways that they need to move forward. So we look at that, we acknowledge the problem that's there, and then we figure out how we can grow and keep growing despite that problem. You know, a second area that we work really closely with clients on is cultivating cultural competence, intercultural competence, multicultural competence. And it's because most of our participants are going to be working in and practicing in highly diverse, highly multicultural environments. And working with a wide range of people who have a wide range of expectations about what the health sector should do, what should be said, should not be said, can be said, cannot be said. So cultivating that cultural competence is a really critical part of engaging in the health sector. You know, human bodies are all roughly the same, but our ability to partake in the health system and to engage in our own health are, you know, always filtered through cultural lenses. Recognizing those cultural lenses and being able to communicate and operate effectively in cross-cultural, intercultural situations, super important. We also work on really being adaptable, you know, actively adaptable, understanding that as situations arise, we're going to need to look at those pathways that we figured out, right? Where we've got a complex medical system with many different types of positions where we could go one way or another way. And we got to be able to sometimes jump, you know, from one branch to the other branch. You know, within one branch, we've got to be able to work very differently with different types of individuals. Really actively adapting to the situations that we're in, asking ourselves really good questions about what's happening and how we are going to adapt to that. Three more things we do here. One is building a supportive network. You know, we're here to help individuals make their career transitions more successful in Canada. A big part of how we do that is to build supportive networks for our clients, to help them build professional and personal networks that are going to contribute to their success. Prior to immigrating, I'm going to guess that most people in this audience have very broad, deep, and successful networks of support. You know, when I immigrated to Canada 17 years ago, I came, only person I had here was my wife. And without that network of support, you've got to really figure out, how am I going to navigate? You know, what do I do when I don't have all of these people from university and my school and people I met at an internship and people from my previous work experience? How am I going to rebuild that consciously and effectively in this new place? That's a big part of what we do. You know, we also celebrate all of those wins along the way. You know, we break our goals and our targets up into manageable chunks, and we look at them and we don't say, well, I'm not here yet, so therefore this has all been a failure, right? The processes that you're engaging in immigration and settlement and your career success have a lot of steps. And those deserve to be acknowledged. And lastly, we really work hard on maintaining a long-term vision, you know, for our participants, helping them develop that long-term vision, for ourselves as an organization, keeping that long-term vision of how we can support people in their career growth, and how we can help to build sustainable change over the long term in the integration of internationally educated healthcare professionals in Canada. So we have our own vision of how we bring about that change. And we've, over the last 4 years, made significant strides in that, where we have really much more actively integrated the support of professional associations, regulatory bodies, government actors in drawing their attention to this issue, but also creating effective solutions that can deal with problems as they sit right now. So keeping that long-term view, recognizing where you're at along that long-term process is super important to your success. Now, how might you move forward? If you've already been approved to immigrate to Canada, but you haven't landed yet, and you're not a nurse, in the pre-arrival environment, we work in very close partnership with Care Center, and they do amazing support for nurses. So for physicians, pharmacists, dentists, allied health professionals, psychologists, psychiatrists, and others, if you've already been approved to immigrate to Canada, but you haven't landed yet, you can reach out to us at this email address, cec@accessemployment.ca. And our staff there can talk with you about the availability of supports for you before you've landed. If you're already in Canada and you'd like support, you can reach out to our Healthcare Connections team at the email here, healthcarecon@accessemployment.ca, and someone will get back to you about how we can engage together on this process. If you're not yet approved for immigration, there's a much more limited set of supports and services that can be available to you. But if you go to our webpage, accessemployment.ca, you'll see something called e-access that has free available resources for job seekers regardless of your status. And you can take part in a wide range of activities, webinars, learning events there that are going to support you as you get ready for that immigration process. So that's all that I have for you today. I'm looking forward to hearing from my partners here at Care Center, and to answering your questions later, and really wishing you nothing but success as you embark upon this journey.
Hi, Cameron. Took me a minute to get unmuted. So here's my video. Thank you for that excellent presentation, and also for sharing your own personal story. We're glad that you also shared some inspiring real life experiences and successes while acknowledging that things are not always easy, and things may not always go as planned. You have to adjust your expectations. We all know that as immigrants, you take a first step to come to a country, you've already, taken a huge risk. And now all you have to do is, well, it's not easy, but you adjust your expectations. And as you said, Cameron, really adopting a growth mindset is important to finding your career pathway. And then there are a lot of other things, important points you've made. It's very hard to talk about it in a minute, but you know, um, looking at your environment from a cultural lens, being adaptable, and something I think is very important that we all forget to do is we're so focused on that long-term goal that we forget to celebrate the wins along the way. So for more information, go to accessemployment.ca. And Cameron, thanks for sharing the contact information. So let's just go to our questions. We have a number come in. I should mention that we do have a lot of participants from across Canada, from the East Coast to the West Coast, but we also have participants from outside the country. So there is a specific question. There is somebody who works with a nonprofit in BC, and they're asking if they can refer their clients to Access. So essentially, if you could talk about any virtual opportunities for learning, or other ways that people from other provinces can participate in your programs. That would be
Yeah,
great.
yeah. If they're reaching out as a sister organization, right, then reach out to us directly. Feel free to connect into us, and we can always talk about how we can offer, mutual supports and services there. There's a chance we might already be doing something together because we engage with partners all across Canada. But yeah, please reach out there. If you're an individual from outside of Ontario, we can help in the ways that we can help, but those are also a little bit more limited because our employer contacts are primarily within Ontario. But if there are services that are available to you in your local area, you may or may not be familiar with them, we can connect you there. And also, I failed to mention, if you are an internationally trained pharmacist in Canada, we're working in close partnership with the Canadian Pharmacist Association on a Pan-Canada mentoring initiative that they're doing. So feel free to reach out to us at healthcarecon@accessemployment.ca to get involved in that pharmacy mentoring project.
Great. Thank you so much. That was good information. So this is a question that's come in quite a few times. You have touched on it, but where can people find pre-landing information? Is there a page on your website where you have this information?
Yeah, so um, it depends on what they mean by pre-landing information, right? Because that could be any number of things. If you're looking for information on licensure pre-landing, that is available through your licensure bodies in the provinces that you're looking at. If you're looking for information about how to engage in employment supports prior to landing, then you can contact us if you're already approved for immigration, and we can provide support and services there. But it really depends on what kind of information you're looking for, right? Because there's so many different things you might need.
Yeah, and it's important, it's critical to spend that time doing the research. Um, it's going to slow down your process, but it'll help you move faster in the future. So are there specific areas that have more opportunities available?
So I'm going to assume that this might be referring to geographic areas that have more
No,
opportunities available.
sorry, I'm just going to reframe my question. My understanding is they're asking, are there any specific areas of work that have more opportunities
Oh,
about the
specific.
career market
Yeah.
per se? Yeah.
Yeah, that completely depends upon the geography, right? Where you're moving to. The needs of the healthcare sector are highly localized. And so if you look at the kind of total overall numbers of positions available, those are always going to be higher in major metropolitan areas just because there are more people. However, if you're looking at the amount of competition for those positions, there's also going to be way, way, way more competition in those areas, right? So if you're thinking about finding that middle ground, where you want to have an amount of positions available to apply into, but where the employers have a much higher need for people, you're usually looking at smaller and medium-sized communities there, where you're much more likely to be able to transition into employment more quickly, and to get more support from your employer. Because frankly, in GTA, in Calgary, in Vancouver, even in Halifax, Edmonton, there's a lot of competition, right? There's a lot of jobs, but there's an enormous amount of competition too. And employers recognize that as well.
Yes, and we talk about TMV, Toronto, Montreal, Vancouver. People
Mm.
usually are drawn there, and settlement agencies, and you brought this up earlier, that it's important to look for opportunities outside of Ontario because there is competition, but there might be the competition might be less. So make some very critical points. Another question, any suggestions on how to find listings of openings now that I've completed my Canadian licensing?
Yeah, so all job postings are going to be there in Job Bank, uh, in the area that you're living within. One of the primary things that is important in your job search is doing that labor market awareness work of making sure you know who the healthcare employers are in your area. In some places, like in the GTA, that's very complex because there's an enormous amount of health employers. If you're living in a smaller community, there might be a smaller number of employers. But the kind of job boards that are available through some professional associations, through your regulatory bodies often have information on that, but also just the regular job postings where all other jobs are available. So I'm not sure if you are looking at that from a nursing perspective. If you are, Rola and Tina would have much more advice for you there. If you're looking at it from a perspective of other health professions, those jobs are going to be posted just like any other job is posted on the job boards of the organizations that are doing the hiring.
And I want to add, you mentioned networking earlier. We've heard often that that is key because sometimes jobs do not get posted externally. It's posted within your organization and shared with your contacts. So let's say you have a mentor within, a larger organization, they will forward this information on to you. So there are other ways. It's not about just applying to jobs. We're all looking for jobs, but we need to go and do as much networking as possible. Um, so there is a question about digital health opportunities, given that, we're going into, I'm just going to expand on that question, given that we're going into AI and we have other technical advancements. Are there specific areas or trainings that could be harnessed by people looking for work?
Yeah, and digital health is a really interesting career path for many of our clients. It's a more difficult career path because, there are things that you do as a physician or as a dentist which can easily transition into having a good understanding of, say, medical administration or clinical research. But digital health initiatives usually require significant amounts of pre-existing digital health skills, right? So it's not kind of a quick or a quicker transition because you have to have the technical skills relating to the digital health initiatives that are being used there. That doesn't mean it's not possible. There's lots of training available for those. And many of the healthcare professionals that we work with have already done some work in those areas themselves, whether they've worked in the rollout of electronic medical records within the hospitals or organizations they worked within, or whether they've worked on kind of predictive AI diagnosis areas. So if you already have some experience, you've got a big leg up. If you don't have that experience, there's training that's available to you that could help you in securing that. But that is an area where the technical skill set is required, right? It's not something you can kind of learn on the job.
Very true. So thank you, Cameron. And we will go to our next speakers. So next up to join us on the Canadian Immigrant Web Conference Series for internationally trained professionals in partnership with Access Employment. We are joined by Tina Novotny and Rola El Mubadar, who will be speaking on career pathways with CARE, which is a Center for Internationally Educated Nurses. So once again, please keep sending us your questions. We will ask them at the end of the presentation. So Tina and Rola, please go ahead.
Well, thank you so much, everyone, for being with us here today. I was just so thrilled to see how many international professionals have been joining us from all over the world, and international professionals spread across this country as well, and some agency people. So welcome, welcome. Thank you for letting us join this presentation. Care Center is now in its 23rd year of service. We were started by representatives from a group of organizations that were very concerned that internationally educated nurses were falling through the cracks when they came to Ontario. So they received some money from the Maytree Foundation to do some research into what kind of supports could be built. And Care Center was born. And we are still very much in touch with, as partners with all of those organizations. They were employers, they were professional nursing organizations. They were educators, and we certainly do collaborate with them actively to this day. We have a motto that is, if you want to go back one slide there, we have a motto that IEN success is our success at Care Center. There's a one-time membership fee of $150. That's membership for life, and you join the family, as we like to call it. Most of our employees have been with the organization for a very long time. I'm in year 13 myself. So with this collage of faces of some of our members, you can see some of the things we'll touch on today. So upper right, those are two members who are actually mother and a daughter, came at different times to Canada. Lower right, that's Cherry. She's a nurse from Hong Kong who joined our pre-arrival program, got well ahead of the registration process. By the time she got to Toronto, she was registered and working in only about 3 months. So we'll talk about the value of the PASS program, the pre-arrival program, because you can see the value there, getting to work so quickly. Then we have Rodolfo over there, lower left. We have a recognition program called the Joan Lesman IEN of the Year Awards. He's one of our winners. And the faces of the nurses. The gal on the right in the center, that's a PASS member who was still in her nursing uniform back home. And then you see nurses in other roles once they're in Ontario, either clinical at the bedside, in the scrubs. And the gal on the left, she's working at admin, and nurse educators also take those roles. So today, for our agenda, we're going to talk some more about Care Center, the pre-arrival program, and Rola has some very insightful information about the current environment for nursing in Ontario. There is a shortage. There are also issues gaining employment, and that's where Care Center is here to help you. We also realize, as Cameron was talking about, once you're employed, that's not the end of our relationship, the end of Care Center's job. We certainly want to focus on the workplace integration of internationally educated nurses, and we do have a new program that we have piloted now, and we'll continue to work with employers on that. So altogether, it's about collective actions towards successful integration of IENs in the inclusive healthcare workplace. I should just mention both the PASS and the STARS programs, as what we call the Ontario program, supports and training and access to regulated employment is the acronym. We are funded by the government, both provincially and federally, so they set the criteria. To join STARS, you have to be a permanent resident, a convention refugee, although we're now allowed to work with refugee claimants. With PASS, you have to be accepted for immigration to Canada as a permanent resident or as a convention refugee. We cannot work with student work or visitor visas, unfortunately, at this time anyway. And we are looking for language levels around Canadian language benchmark 7, so that we have a more level playing field for success of the members. And now Rola, as she put in the chat, that has come through the program. She has a lived experience, so she's certainly going to give you a lot of information today.
I'm trying to unmute myself. So hello, everyone. Maybe it's morning, maybe it's afternoon. So good morning, good afternoon, and good evening, maybe, because I see some people are joining from all over the world. And I myself considered to be very international as an internationally educated nurse. So I'm Rola Al-Mubadder. I'm the program manager at Care Center. I'm an IEN myself who actually went through the journey back in 2010. And with the support of Care Center, and Tina was there as well for me, highlighted me as a success story in Toronto Stars. I take so much pride in what I do today with Care Center as a program manager and as supporting the team and other IENs. And thank you for the Canadian Immigrant team for inviting us today. Thank you for our partners and colleague Cameron from Access Employment. We work so closely together in order to ensure that all the services and the supports needed for internationally educated IENs and professionals Though we are uniquely actually positioned at Care Center to support internationally educated nurses, we do always refer other health professionals to the experts, like access programs and services as well. So I think my colleague already mentioned, Cameron, about the win-win situations. So at Care Center, we do believe that IEN success is our success, and not only IENs, because at the end of the day, any one of us who chose Canada as home and to immigrate to Canada, and we're looking here at ethical kind of recruitment, because we do not ask people to come to Canada. We choose as immigrants, including myself, Canada as home for our families, for our future as well, like career development and advancement. So the Canadian healthcare system benefits from the talents, the skills, the specialized expertise, like including myself. I am a nurse educator. I've been in nursing education and in nursing consultation, quality development, and also in nurse informatics for over 24 years in a diverse clinical settings. So coming to Canada, myself and other IENs as well, who are more talented even than myself, come with the dream to pursue their career and advance it. So here we are to help and support their goals. And I liked how Cameron actually referred, we're here to meet you at where you are. What are your goals? And we're not going to let anyone actually dictate what is their future. You are the owner of that future, of your career development, and of the choices you make regarding your goals and your career and your profession. So as nurses, I would say once a nurse, forever a nurse. So I wouldn't actually trade my nursing profession for anything else. And that's what perseverance is, that I decided like I'll do whatever needed to go back into practice, and not only just practice, to go and be the kind of one of those leaders who will help and support other IENs to be actually in a leadership position, to become the future leaders in the Canadian healthcare system. So that's the win-win situation. I'm not going to elaborate more. So we're not only here to say what we do and how we do it, we say why we do it. We do it because we need the success for everyone. We need the success for the internationally educated nurses. We need to ensure our healthcare system is really not suffering and really collapsing at one time because of the shortage, because the nurses are at the core of the healthcare system. We do work in an interprofessional team, but still nurses, they are the ones who actually first kind of support the patients and assess the patients and refer the patient to any specialty they need to follow up in the healthcare system for the better health, for improvement of their patient care. So I think I'm going to move to the next slide, but I think already Tina mentioned about our both programs, and also thanks to Cameron, had referred to our pre-arrival support services that is funded by the Immigration Refugee Citizenship Canada. So we actually have been serving thousands of IENs since the launching of the program, and two sides of the house for the PASS and for the STARS program. And now actively, like I would say more than 5,000 to 8,000 now IENs have been served in both programs combined. But now actively we have more than 1,000, because the rest are alumni. They are our ambassadors, I would say. They are our expert nurses that we refer to them. They support other IENs through our mentorship program. So we keep great contact with our clients who already finished the program, completed it, but they never kind of cut ties with Care Center. And I am one of them, because even I actually got registered, got my license. I kept actually coming and delivering some courses as an educator, facilitating, developing courses, and also being an ambassador. When one time, actually, I was back in Dubai, and one nurse, she talked to me there in Dubai, and she said, I'm moving to Canada. What are your tips? Because I was back and forth between Dubai and Canada. And I told her, you don't have to waste time. Just directly go to Care Center. They will provide you with the support that that needed. And that day I received an email from Tina, and she said, I was actually sitting next to the lady who actually you referred from Dubai, and we are providing support to her. So this is how actually the relationship of all clients at Care Center, it's a lifelong membership. It's not just one time, it's forever, I would say. And here is actually, I'm not going to go dig and dwell into this, but I think the journey is similar for all IENs and many healthcare professionals. They need actually to navigate the credentialing process. They need to know what is the assessment looks like. For the nurses, it is they have to put an application, and through the NNAS, which is the National Nursing Services, the National Nursing Services, NNAS Assessment Services. I missed the A. So when you start saying the same acronyms all the time, so you miss on them. So what we do is we help them navigate all those kind of different pathways for registration and licensure, because again, we work nationally through our pre-arrival program, and we work provincially through our STARS program. So we do actually navigate all the regulatory licensure process at the various provinces at the nationwide, and also in Ontario through the College of Nurses of Ontario. And I would say, like the country have been working so hard, our Chief Nurse Officer, Dr. Lee Chapman, working with many provinces across the territories in order to have a more standardized, more consistent actual licensure process. But there are various actually kind of factors that in the kind of the way licensure is actually the requirements have been put in place, or the laws and the regulations, because each province have their own kind of healthcare system that functions at the provincial level. But there is a lot of collaboration taking place on and making a more actually the transition from one province to the other more easier, and ensuring that there is a fast track in the licensure process. I might go on and on, so please, maybe Tina, keep track of the time so I will not miss on the so many informations that are helpful. And I can see from the chat of many of the IENs on the call that they are keen actually to know more and more, and I don't want to miss on these information to provide it to the audience today. So navigating credentialing the process, one of them. Having mentoring opportunities is another. We're going to talk in details about this. Also preparing them for the licensure exams like the NCLEX, the new generation NCLEX, the NGN, or also the IronCAP, which is actually used to be the OSCE or the IronCAP in the earlier. We look at many academic pathways for the bridging, because some IANs are they require more actually educational courses to meet the gaps of the requirements according to the licensure requirement. Also, we do not stop, as also my colleagues mentioned, Tina and Cameron, that we don't only stop at the moment when they got licensed, the IEN. It goes beyond. We want to make sure that they are actually getting their career goals achieved, and they have access to all employment. And something that was mentioned that I want to emphasize on is networking. Yes, actually, I would say service providers like Care Center and Access, and they support in those networking, because it's not only what you know, it's who you know. And through this, actually, sometimes we get uprooted, because when we move to a new country, we don't have our colleagues from back home, we don't have friends, we don't have the family members that would actually direct her and support us, to tell us what, as IENs, and I'm talking about us because I was in this journey. So there's no one to tell us like where to apply, how to apply, and what is this kind of job description looks like to us, and do we fit and match in this job? Is our resume tailored to that job? Is our resume as actually matching our profile, matching this job that we're applying to? Because sometimes we miss this while we are working on our resumes. So here we are at Care Center. We do have a lot of support through our case management one-on-one to help and support in those kind of employment strategies for resume writing, for mock interviews, and so on. So if you look at the arrows through all these stages, from the beginning, pre-arrival to post-arrival, we do support one-on-one case management. We do have mentoring program. We do support in networking and exam preparation for successful results. And it's sometimes up to 99%. Our clients, they will be succeeding in those exams. Language and communication, and there's a lot about language and communication. I will leave this to Tina. Employment strategies and partnering with our partner employers to ensure that we are referring our clients for employment, and also supporting them through our workplace integration program. The trends and realities, unfortunately, that was a predictable kind of shortage from back in time. Earlier, pre-pandemic, that CNA projected critical nursing shortage of 100,000 of nurses by 2030. And the pandemic actually exacerbated this number with additional pressures on the nursing workforce, a lot addition of workload, and also the burnout and stress stemming from the I would say from all of that, and from the pandemic, that we have nurses leaving the profession, and I would say that's not a good sign, because the more the shortage, the more we are in a kind of in a vicious circle, and we don't want this to happen. And that's why IENs play a very crucial role in actually meeting those gaps in the shortage and bringing more talents and more, as I said, skills to the game in the Canadian healthcare system. So all what is needed is more actually recognition to the valuable part that IENs play in the healthcare workforce, and bringing more specialization as well. And countries, they now actually have a lot of competition with the immigration laws they have, and with the integration of the IENs. So we are competing globally on those IENs. So the Canadian healthcare system is working, I would say, tirelessly on just ensuring that we are not having those IENs coming to Canada and leaving. So because we are having this actually trend coming on. So we don't want to have this happening to our Canadian healthcare system. There has been also prediction on the Ontario government that the shortage will be 33,000 nurses by 2028, which is, again, this is not a surprise to us, doesn't come like a shock, because we are following this years and years, and the shortage of nurses is global. It's not only in Canada, but some countries are working on different strategies. So as well, Canada is working as well. And we have the toolkit that has been launched by our chief nurse officer at the federal level, that is helping as well the employers and helping the provinces and how to meet their actually workforce needs from nurses. So again, I'm not going to emphasize this more. IENs bring refined skills and expertise in highly specialized nursing settings. And the CNO, I'm talking about the CNO because here where I reside, and this is the program that I follow on the STARS program. So we work very closely with the College of Nurses of Ontario. So they started the ASPA program that I would say Care Center had piloted this. They were the pioneer actually during the pandemic to launch the version of the ASPAP, which was actually piloted by Care Center and our partner employers like UHN, Trium Health Partners, Sunnybrook. So the ASPAP program, which is called the Supervised Practice Experience Program, helps helps those IENs who do not meet the requirements through the safe practice, because there is a window for the IEN safe practice. So what helped them is actually during the pandemic, because they couldn't go back to their home country, to actually do this safe practice experience and meet the requirements by the CNO. So Care Center did this kind of program with other, as I said, partners, and helped over hundreds of IENs, I would say almost 300 IENs, to meet this safe practice requirement by the CNO, and they become registered just after meeting those number of hours, which were around 400 hours. And this SPAP program, it's still going on at the level of the province of Ontario. And I think other provinces as well, they're looking into something similar to the SPAP. But as I say, we take actually initiatives and pioneer in this, as Care Center has piloted this back in the time. So other trends you look as still kind of, regardless of what we do, we're still faced with some challenges and barriers. And I think Cameron referred to this, that we still actually have challenges in the employment side. And I would take this as an opportunity to say, like, and I saw as well in the chat that someone is talking about, we need to market to ourselves. And yes, it was mentioned as IENs, marketing for oneself is important. Maybe at our home country, we were not as competitive as in Canada. So there's a lot of competition. So now it's the IENs as well role to work on their actually resumes and on their actually recruitment skills in terms of the interview skills and how they want market for themselves in an interview. Because sometimes I will take this example from our colleagues who actually do the mock interviews in the employment strategy workshop. Some IENs actually, they do not reflect on their actually weaknesses and strength when they are asked, like, what are your weaknesses and what your strength? Because some cultures, they found that reflecting on this or mentioning the weakness will not get them the job, which is on the opposite in the Canadian labor market. In an interview, it is expected from the interviewer to hear that, yes, I do reflect, and these are my weaknesses, and these are my strengths as a candidate. And this would bring more, actually, I would say, competitive edge to the candidates as IEN. So I'm not going to go more, but I would say the CNO, the College of Nurses of Ontario, doubled and tripled the number of registered nurses of IENs during the past few years. And this is because of the modernization of their licensure requirements and the language proficiency requirements, broadening it and actually helping, removing barriers as much as they can, and including and keeping in mind that there is the public interest and safety in place. So we do work together, as I said, with many stakeholders, employer partners, and the College of Nurses of Ontario and other actually College of Nurses in other provinces in order to ensure that the IENs are supported. So moving to the next slide, and I'm trying to, as much as I say, like, there are certain realities in place that IENs are still not actually making a big portion of the workforce, but they are moving towards the right direction with our support and other actually partner support and stakeholders and other programs like the Access program that Cameron had referred to, our colleague. So there will be more opportunities for IENs and a more actually increase in the rate of employability as well. So the next thing I would say is challenges and barriers. Okay, Tina, how am I doing on time? I'm so cautious of time.
We are at 2 or 3 minutes after 2.
Okay, and what is our time?
Rola, I can answer that. You do have a couple of minutes, so please go ahead and yeah.
Okay, so whatever we are going to talk about is that we need a successful transition and retention of IENs within the workplace. And this requires employers to acquire additional knowledge and skills and leading practices and strategies to assist in the integration and onboarding of IENs. And this is where our actually workplace integration program comes in place. So let me just move. These are some of the barriers that are faced by IENs. But again, these barriers are all actually been supported through our programs, through our language and communication program, through our other programs as well. So Tina, before handing this to you, I'm just going to mention something about, and I'll get back to this, about our workplace integration program, which is, I already mentioned, because I don't want to miss on the opportunity of highlighting, oh, I'm sorry, My screen is a bit frozen. Let me see. Okay, so this is our case management model. I'm sorry, I don't know what's happening, but I'm having difficulty with technology on moving these slides forward. Okay, so, okay. May I actually kind of stop sharing and reshare? Okay, it's moving now. So I'm gonna actually stop sharing and reshare because I think it's giving me a bit of a hard time moving the slides. So I'll get into the slide easier and then I will.
Just wanted to jump in to say that there is very detailed information on our website. So if you go to carefornurses.org, you will be offered to go to the PASS, the pre-arrival program, if you're not yet here. And then the STARS side will give you information for IENs in Canada. Again, there are certain immigration status criteria that you would need to have to be able to join. But you can always visit the website for more generalized information. We have a lot of webinars there that are open to the public, and we have podcasts too. So I hope you visit the website.
Okay, and I will ask for a few more minutes, and this is about our workplace integration program. So it helps actually recruit, integrate, and retain because we have a close network and partnership with many employers. And these are actually, sometimes I would say employers, they are hesitant to recruit IENs, sorry to say this, but again, with these kind of workshops that we offer employers, it support them in their actually onboarding and recruitment process to ensure it is a kind of an ethical, and it takes all the principles of equity and diversity and inclusion while recruiting the IENs, similar to those actually workshops and webinars that we offer for our partners. We do actually have the same for our member IENs and for IENs who are actually already working with organization and they are having some challenges or difficulties. And this is actually proven that this actually funded program between the period of February and March, we actually got to have 47 sessions and 27 organizations joining Care Center. Unfortunately, the funding came for this only short period of time, but we still offer this through a certain kind of course, and we're looking for more funding on that because it's supporting employers to recruit more IENs. So, and I'm gonna leave you with this actually quick video, it's few minutes, that actually highlights all kind of programs and services for Care Center.
I guess it's buffering or something.
I think it's, yeah, sorry. Are you able to hear the...
The volume was pretty low though.
I find it so very important for the IENs. As nurses, we know we're lifelong learners, and coming into a new country, the challenges are unspoken or unknown. Yes, we are all nurses, but there's different cultural aspects, different language barriers, different scope of practice. And with our professional development courses and workshops, we're able to address these and support them in many ways. We have 4 big categories of workshops. One is nursing essential skills. The other one is communication and workplace integration. The third one has to do with their nursing registration process and course preparation. And the fourth has to do with employment and career development, connecting them and building their network with employers.
As a mentoring program lead, what I do is support internationally educated nurses and match them with expert nurses. We do have 2 kinds of support. One is observational job shadowing and one is virtual mentoring. In these 2 opportunities, they're having a chance to connect with an expert nurse, talk about and learn from them regarding their scope of practice, their routines. And we do have different facilities such as hospitals, long-term care and community nursing agencies.
Care Center for Internationally Educated Nurses also offers a pre-arrival program for people migrating to any province or territory in Canada on a permanent resident status. And we have different services to help them on their licensure and employment journey. So we do one-on-one case management, helping them navigate the licensure process across the country. We do a series of informational webinars on nursing in Canada, the assessment process, the Canadian healthcare sector, Canadian workplace culture, and we also offer mentorship opportunities with the Canadian Nurses Association.
Being a case manager is beyond coordinating. It's understanding and tailoring what their needs are. There's a lot of references or referrals that we can do. We have a lot of interesting programs set up for the storage program, observational job shadowing, virtual mentoring. These are all programs that they could avail when they become a member of Care Center.
It's amazing to hear back from other INs. It's very important hearing back that these have supported me into my integration. Without these courses, I feel I was lost. Comments like, thank you for providing us the support that we needed and we didn't know where to find.
When I see an internationally educated nurse, I just don't see their qualifications and skills, but I see their hope, their dreams, and then the challenges that they go through, because I've been there myself.
The benefit of Care Center's Internationally Educated Work Integration Program is mammoth. There's an understanding that INs, internationally educated nurses, come to Canada, to Ontario, to Nova Scotia with a wealth of experience in nursing. The way that it's practiced may be a little bit different. And once they're actually hired, the support that's given to them in the new work setting is very important to make the person feel included, supported, involved, and that usually increases the retention level.
For all internationally educated nurses, I think we all need this program. And the reason why I would recommend it for every internationally educated nurses is because it's going to help them to practice in a safe manner.
I decided to take the course because I wanted to be more experienced and more knowledgeable about the physical assessment here in Canada, because unlike where I come from, we don't do it the same way. So I believe that taking this course will give me more knowledge and equip me better to integrate into the healthcare and give better care to patients.
I have a message for internationally educated nurses as soon as you come and join the Care Center, because it's very helpful. Even if I'm RN, I'm still with the Care Center to upgrade myself.
It was a wonderful opportunity to work with the internationally educated nurses to help to get to know them, share their experiences, and enhance their clinical skills in health and physical assessment.
I just wanted to invite everybody. The OJS is a very powerful tool in order for an IEN to learn.
I'm really sorry to take over the time, but I'm here to wrap up. There's a lot of information on our website. Ramya is going to share this with everyone. And also, please do not forget to have navigate our website for the success stories. And I'm going to share the last slide, which has our website and info email. Do not hesitate, please, to reach out to myself, Tina, through the info email. Just put attention and we'll be happy to guide you through your journey. Thank you again, everyone. And for actually, my apologies for making you to stay over time.
So Rola, that was very inspiring, that video at the end. So I'm glad you were able to play it. So thank you, Tina. Thank you, Rola. And Tina, thanks for sharing information about the various programs offered by CARE and for sharing real life experiences like Rola. Rola, it's great to hear about your journey. I must mention that there was a chat message that said, excuse me, I'm proud to see my teacher, Rola El Mubader, here as a speaker. So there are people in the chat who know you personally as well. So Rola also acknowledged the challenges that are being faced, but emphasized opportunities for nurses to move forward in their career and current trends. So this was a very comprehensive question. We are over time. So I'm going to ask you one question. However, you've shared your information online. So if we don't get to your question, our audience can write to you directly. So thank you for sharing your contact. Um, so the question was, will your slides be available? If somebody writes to you, are you okay to email the presentation to them?
I would say because it's a recorded session and we mainly touch on most of the things in the slides, and we have every month an info session, I would say I will not share the whole kind of slides. I would encourage people to join our monthly sessions. I will share the short version of the slides with you, and feel free to share it with them. Yeah.
Okay, that sounds good. And folks, you can also write to us at info@canadianimmigrant.ca, and we can see how we can connect you with the speakers. So just another question. This is very broad, so maybe you could take like 30 seconds to answer this. When there is a nursing shortage, why is it so difficult to find jobs?
Yeah, I actually will say one of the things that I mentioned is IENs, either they actually, like this is a two-way process. It's the IENs and it's the employer. And there are actually, sometimes these are the mismatching. Either the IENs not well prepared in how to put the resumes in, or not choosing the matching jobs for them. That could be one of the things. And unfortunately, I would say this word, and please don't quote me on it, but sometimes the IENs, they look like the aliens coming to a new setting. So they need to get the network. So that's why mentoring is one of the things, to let people know their skills, their talents, their expertise, because at the end of the day, the recruiters as employers, they want to ensure that they're recruiting the right place for the right person for the right position at the right time. So this is kind of bringing this trust, relationship, and networking and mentorship would help and support in that.
Thank you. Thank you so much for that. Thank you to our speakers from CARE for all that great information. So we're going to move to our third set of speakers. Our final speakers for the day at the Canadian Immigrant Web Conference Series for internationally trained nurses and medical professionals is Alasoba Kelsey Braid and Heather Landry. They're both from the Blossom Group. So if you have questions, once again, please type it in the chat in the Q&A, and we will see how many questions we can get to at the end of the presentation. So please go ahead, Alasoba, Heather.
Thank you very much. We will try to move quickly through the presentation so that there is some time for questions at the end, as I know we have a hard stop at 1:45. So welcome. We are from Blossom Group, which is a company that owns residential treatment homes for both children and adults with developmental disabilities and complex diagnosis. I am Heather Landry. I work as the assistant clinical director for the company. I've worked with the company now for just over 6 years. I have myself a master's degree in applied behavioral analysis. I am a board certified behavior analyst and work within the clinical department that offers treatment for the individuals who come into our care with us. And I have worked within the field of applied behavioral analysis with both children and adults for about 13 years now.
Hello, my name is Alasoba Kelsey Braid. I came to Canada from Nigeria 2017 as an international student and to pursue a child and youth care program at the Georgian College Aurelia campus. So after completing my 3-year program, I started my new journey with the Blossom Group as a direct care worker in one of our 9 locations. So following my initial tenure at the Blossom Group, I gained another additional experience through another healthcare organization, and later went back to Blossom, transitioning into a role with the People and Culture Department in the Human Resources Department. My apologies. I have been contributing to the department ever since, leveraging my diverse background and expertise to support the organization's mission. And presently, I'm taking a program in Georgian College, their Human Resources Management at Georgian College.
Wonderful.
Yeah.
So just a little bit of background for you around what Blossom Group is. So it started in 1988 where Dr. Howard Bloom and his wife Sherry Ann Bloom bought a 100-acre farm property in Oro-Medonte, which is just north of Toronto, in which they founded what was known as Blooming Acres, then now known as Blossom Group. And so they started this project in which they lived in the home on the property that they had purchased, and they really created an intentional community where they had 10 people with various complex special needs come to stay with them. They then innovated the concept of respite through the farm experience, through weekend retreats, recreational summer camps for complex care, and then provided live-in schooling for people with complex special needs. It then further developed in 2013 where the Blooms partnered with Dr. Robert Cooper, who is our medical director and co-founder, to continue and expand really the good work that they had already started with a mission to provide exceptional quality care for people who require really specialized person-centered care, in which they no longer are able to live at home with their families and need somewhere where they can be cared for and have their complex special needs accommodated for. So just to quickly go over the two individuals as part of our leadership team, one is Dr. Howard Bloom, who is the founder of Blooming Acres. He has a PhD from the University of Toronto in teaching and learning and a doctorate in philosophy. He also has a master's degree from the University of Toronto in applied psychology, special education, and adaptive instruction. And he is currently also, on top of the company, a professor and department coordinator at Georgian College for the child and youth care. He also works within research and really has worked within the field for over 30 years. And then our co-founder, who has started in 2013, is Dr. Robert Cooper, who is, again, a founder and our medical director within the company. He has a law degree as well as a physician graduate from the University of Toronto Medical School, and he completed his family practice residency at the University of Toronto and has clinical practice at Dufferin Street Clare Community Clinic in Toronto and in Orillia, and currently is the board member with the Ontario Long-Term Care Clinicians and the Ontario Long-Term Care Physicians as well. And so he works as part of our board as well that oversees the care for our clients. To talk a little bit about the individuals that we care for. So who do we support? We really do support both youth and adults with complex special needs. Many of them are moderate to severe neurological and developmental and or cognitive issues, such as autism, fetal alcohol syndrome, and often have comorbid diagnosis such as intellectual disability and other mental health diagnoses as well. It's complex when these issues are really combined with those mental health issues, such as anxiety, mood challenges, poor self-regulation, social deficit challenges. And we really do work as a team in regards to our frontline staff and our clinicians to really provide a wholesome approach to the care that we are able to provide them. The people with complex needs really do deserve skilled and quality support, and we provide a minimum of one-to-one support for our clients, whereas many of our clients are highly complex and require sometimes a higher ratio than that to support their needs. A little bit more about the company. So in 2005, our farm program in Oro-Medonte became licensed as a children's home with the Ministry of Community and Social Services. And since that's the picture that you see on the screen there is the original home. And since then, we have opened 2 additional children's homes for a total of 3 that house from 7 to 10 individuals. And we have 5 community-based programs that are smaller and provide more community and independent skill level opportunities for those individuals. We also currently have 1 adult home that gives space for 20 adults to live. And we are currently from ground up building an additional adult facility that will be opening in February of 2025 that will allow the opportunity for 28 individuals in the first phase of the building to come live as an adult there, with opportunities that include farming and animal care and recreational therapy and things like that. As an agency, we also work under a care philosophy in which our organization has taken on this program through Cornell University. They developed the method, and it really is aimed at improving the lives of youth and adults living in short-term and long-term residential care. The philosophy works under 6 principles that we look at as really providing a wholesome approach to how our frontline staff, all the way to our top level CEOs, are working towards providing a comprehensive and wholesome approach to how do we provide the best level of care for these individuals. And those concepts include being developmentally focused, so looking at their development and not just their age, relationship based, and how you create those relationships for those clients that we're caring for, being trauma informed, given that individuals experience trauma in their past as well as sometimes within their current lives, and how we approach that care considering those things. Family involved, so really making sure that although we have our clients living outside of their family homes or sometimes far away from their family homes, that we are considering that involvement as a key and core aspect to those individuals' lives. Ecologically oriented, so really looking at the environment that the individuals are living in and how we can't support that environment to create the best outcomes for our clients that we do care for. And then competence centered, ensuring that there are 2 levels of competencies that we really need to provide quality care from. And that is the competencies that we are providing our clients. So what are we teaching them and involving them on a day-to-day basis? And the competencies of our staff. So making sure that our staff are well trained in many areas to ensure that the quality of care that they're able to provide is well informed and research based. A little bit about our clinical department. So our clinical department has grown significantly over the last 6 years, and it consists of a clinical director, myself as the assistant clinical director, clinical supervisors, behavior therapists, behavior associates, and instructor therapists. Each of these roles require a different level of education and certification, as well as experience to fulfill them. Our clinical director, all the way down to our behavior therapist, required to be board certified or to have some level of extended education to help support the level of expertise that they would require in those. As I said, I have a master's degree in ABA myself. And then we also provide training to the other levels of that clinical department to ensure that the quality of their role is supported from experienced individuals that are above them. And at the end of the day, though, each of those roles work together to create things such as behavior support plans, skill acquisition programming, behavioral interventions, complete ongoing assessments, intrusive intervention protocols, and important support for clients, both medical and behavioral needs, as we meet with psychiatrists, psychologists, and medical doctors on an ongoing monthly basis for our clients. Every client is placed in a caseload that is supported by each level of the clinical department. And the clinical department supports our frontline staff who work with regular and ongoing training, as well as consistent supervision on the progress of any goal, strategy, program, intervention that is put in place for those clients.
So what are we looking for? Like we said, the Blossom Group is we're always employing. So we're looking for internationally experienced or volunteer people that have volunteer experience. So we're always looking for individuals with that can work with us and that can give our clients what they need. So by joining Blossom Group, you become part of a dedicated team that values inclusivity, diversity, and high quality. I forgot to mention that most of our staff come from diverse background of culture, so we have different people from different culture, and we seek team members who share our commitment to excellence and who are ready to make a meaningful impact in the lives of our clients and the people we support. And the qualities that we're looking for in these individuals that will want to join our team should be people that have empathy, that is compassionate, somebody that has deep commitment to understanding this and supporting the unique needs of our clients. Most of our clients are nonverbal. So how do you help this client every day to make sure that they have a good day? By also ensuring that they have that caring and nurturing environment. somebody that has a strong communication skills. Coming from Nigeria, I know sometimes my accent and the rest is a bit difficult, but we encourage people to come in, the ability to communicate effectively and empathetically with our clients and families, and also your colleague, because some people we're working with, my co-workers, when I was, even till now, are from different backgrounds, but we have to have that communication skill to be able to understand each other. And most of our clients, like I said, that are nonverbal, we use some communication device to be able to understand. They just, like, we call it PEG. They press what they need and it tells us what they need and we help support them. And other people were also looking for people with team mindset to be able to collaborate, to work with other colleagues, and a commitment to contribute to a positive and inclusive workplace culture. Cultural competencies, be sensitive and respectful to cultural diversity, inclusivity, because like I said, most of our staff come from different backgrounds, and even our clients too, or people we support are from different ethnic group. Heather, can you just go to the next slide, please? Good. So the good thing about the Blossom Group is that we're constantly training people. So when we train people, we try to make sure that this training is what we use to help the people we support. So orientation, obviously, the orientation is online and in person. So most of our trainings, you do online and you do in person. Also, we have the safe management training. Safe management training is a training that helps us to train our staff in verbal de-escalation, blocking, and physical restraint techniques. Most of our clients are non-verbal, so we try to make sure that everyone is safe when they are in that space of, because every behavior is something a client wants is expressing to you. So if they can't express it, they come with a behavior. And then shadowing and mentoring. So when we employ these people or the new employees, there's always shadowing. You're going to be shadowing an older staff, and the older staff will be mentoring you. And this will take 4 to 5 shifts. You don't just come into the company and we throw you into the workforce. No, we make sure that we shadow you and we mentor you. And if you need more shadowing or you think you're not comfortable, you can talk to your floor supervisor and we can see how we can make sure that you're comfortable in that space. Care training, like Heather said, 4 days in-person care training. Care training, our philosophy. I love it. It's so good. For me, coming from a different lens, coming from a different country, it's something that exposed me to seeing things from different lenses, right? The relationship base, the competencies, in fact, the developmental, the ZBD, the zone of proximal development, we can see an adult, somebody that is 18, but in his head is 3 years old. So we need to make sure that we have that. That's why I said from the beginning, you have to have that empathy to be able to take care of the people we support, else you can't work in our field. Then the training academy is another 2-day full direct care training that we do for our direct care staff to make sure that if there are new things we want them to do, something, new skills we want them to learn, we go into their houses, train them, or we make sure that we take Edda, if you want to jump in and explain better on that.
Yeah, essentially, a lot of the training academies are focused on ensuring that our direct care staff understand our clinical documents and are able to implement them on the floors effectively. So we have a lot of clinical documents, and we don't expect that every staff is going to come in and really understand the clinical language or the documents itself that outline how we would provide specific care to specific individuals, because the care that we provide is exceptionally individualized to those individuals based on their diagnosis, their level of functioning. And so this training really does focus on those documents and how do we understand them as well as implement them effectively.
And then there's a floor supervisor training. You become a floor supervisor doesn't mean you won't go for training. You'll go for more trainings, because not one size fits all. most of like I said, we have 9 locations, and everybody comes with their own piece of different way they see in different locations too. So we constantly train our floor supervisors for them to work effectively with the clients we're supporting and even with their co-workers too. And then we do co-op and placement. Like I was a child and youth care student when I was in college. I didn't have the opportunity working in a residential setting, but we also take students that are willing to do placement there, co-op there. In that way, we help them see a bigger picture of the field they're about to get into. And if they're after their placement or co-op and they want to stay back, we employ them too. And that's the beauty about the Blossom Group. The next slide, please. So growth opportunity. My story, like I said before, I was a direct care worker from school, direct care worker, and today I'm the people and culture in the HRO department. So where there's always growth opportunity in our organization, Blossom Group, we're committed to the growth opportunity and development of our employees. I know somebody that we all started as direct care. The person is now a floor supervisor. I know somebody that is already a supervisor, an assistant manager, program manager, clinical department. The beauty about our organization is that we look from within because we know that these people already have the idea or know the clientele we'll work with. And we make sure that they get, like Eda said, they have to have the qualification or something, but make sure that we pick from within. Except we can't find it, then we look outside. But we try our best, and our non-caring roles are often filled with those who have worked as direct care. Like I said, we know our clients, so why not pick from within? Except we can't find it there, then we can go out and pick. So we're committed to professional growth. We're willing every time, like we're trying to make sure that everybody is part of this Blossom Group. Thank you. The next slide. And I'm excited about the community events. So we regularly organize events that promote cultural awareness, celebration, inclusivity for the individuals who support and their families. These events are designed to foster a sense of commitment and belonging while celebrating the diverse background and traditions of everyone involved. The Cultural Diversity, Inclusion and Belonging Committee, which I'm one of the part of the group at Blossom Group, ensures equal opportunity and a safe environment where everyone can be their full unique self. We meet quarterly, either in person or virtually on Teams, and explore. When we meet in person, we explore different cuisines, and that is a good one too. So we love to host events. And you can see from the slide, these are some of the events that we're showcasing on the slide. And in a few weeks' time, we're having a festival of festivals, and that we're all looking forward to, not just the staff, the clients, the family, they come with their friends, and it's a beauty to behold. The next slide. The next slide, please. Thank you. So why not come live and work in Simcoe County? In 2018, Simcoe County shined on the national stage with 14 out of its 16-member municipality alongside the city of Barrie and Aurelia. Oh, I forgot to mention, so we have one of our locations in Barrie, Minising, and then we have 5 community based in Aurelia. So you can see now the map is on Barrie and Aurelia. The country now knows us. So the city of Barrie and Aurelia ranking among the top 150 of Canada's best places to live out of 415 communities across the country. Since then, there has been a light on Barrie and Aurelia. So Simcoe County truly is a destination for all seasons, offering something for everyone to enjoy year-round. Thank you for listening to us. We encourage you to reach out to us. Our contact information is on the slide, on the screen. We look forward to hearing from you soon.
Thank you so much. Thank you, Heather. Thank you, Olusoba. That was a great presentation. Heather, thank you for giving us a full picture of Blossom and the various areas of work of your organization. I must say that people with invisible disabilities like autism need support because, it's not visible. These are invisible disabilities. So, great work that your organization is doing. Elisabeth, thank you for sharing your personal journey, the process of how to become a part of the Blossom team and the various opportunities available. So let me ask you, are all these opportunities posted on your website?
Sorry, come again?
Are all these opportunities posted on your website?
Yes. I know Eda mentioned that we're opening a bigger facility in Tay Township, is in Midland. Tay, so it's I tell people I came for the immigration job fair with my colleague, and most people didn't know about Simcoe. They knew Barry, but they didn't know Aurelia. And thanks to Cameron, the first speaker, he said he mentioned something about going to smaller communities. So when I came to Canada, it was Aurelia I stayed, and I've not moved. This month made me 7 years in Aurelia, and it's been a journey. I came with 2 kids, 5 and 8, and it's amazingly, the community just welcomed us, and I don't think I'm leaving. I know I'm not, because I'm building that community. So when I tell people go to places where you function well, I know the GTA has a lot, but come to Simcoe County, we have lakes, it's quiet, it's 1.5 hours away from the GTA. You can have everything you want. People still live in Simcoe and still have the best life. Thank you, Tina, for nodding your head, because you know what I'm talking about. It's a place where I believe people should come, move, just come live with, it's exciting.
I love your energy. And you know what? I'm going to look up Simcoe County, the website, soon after we get off this call. Toronto is great, but
No, trust me. It's beautiful, and people feel that there's no divers. It is happening. It's coming. They're moving down. Thank you, Tina. I like the way they're moving down. It's expanding, So I'm glad that I'm part of this community.
Well, newcomers recognize the quality of life, I guess, that's not the stress of being in the GTA and all the
No.
stresses we have here.
Mhm. Okay, so let me go to the questions then. There was a question about virtual opportunities, but I think it might not apply since it's more in person, the services that you offer. So the next question is, do you offer any volunteer positions so that internationally trained professionals can get experience?
For the volunteering, if they can reach out to the HRO, the email is there. They can reach out, and then we can take it from there. I can't give you a yes answer because I need to be sure if it's a yes or, so I think they should send an email, and then we'll take it from there.
Yes, okay. And you have shared the HR email right here. So folks, that's something that you could take it down, although this is going to be posted after. And yes. So do you recruit IENS overseas willing to relocate to Canada?
So long as they have their permanent residence or they have their job work permit, yes. But if to hire all the way from there, I will say no, because Tina, the hustle about, or the challenge about trying to bring them down and all that. So if they have their work permit, they have their if they're students or work permit or permanent residency, yes, we can employ them, so long as they have experience. And I forgot to mention, even if for the students, they must have at least 6 months experience to work for us.
Okay, and you talked about training. Now, are these trainings paid?
Heather, do you want to? The trainings are not paid. Okay.
Yeah, if you are employed and we are training you, they are you are receiving pay to be trained on all of the different courses and the different different levels of training that we offer. Yes.
Okay, great. Folks, if you have other questions, please email the Blossom group directly, the HR email. So we're going to wrap up the session. Thank you to all our amazing speakers and all the amazing information that you've shared with us today. And thank you, of course, to the attendees and, of course, to Access Employment who are partnering with us on these webinars. If you've missed anything, the webinar is posted, will be posted on our website. And if you have questions, please email info@canadianimmigrant.ca. So just one thing before we leave, the Canadian Immigrant Fairs are happening across the country. Sign up to our newsletter on our website because we send you information about events and other informations that are happening around you. And to our speakers, we welcome you to write articles if you would, and we are happy to share information on canadianimmigrant.ca. So the next event happening is in Vancouver, in-person event on October 24th and Mississauga on November 14th. This is the Canadian Immigrant Fairs that I'm talking about. I jumped around a little bit there at the end. So thank you all, and I wish you all a wonderful day. Take care.